My name is Edel O'Toole, and I'm very pleased to introduce Dr. Xiang Li Tan, who's a newly qualified doctor at Barts and the London School of Medicine and Dentistry. And as a medical student, she has been working with me on this project on neurovascular structures on the feet of patients with Pachyonychia Congenita. And she's going to tell you about this research.
Thank you for the opportunity to speak about this research. The most reported symptom of Pachyonychia congenita is plantar pain. Putative neurovascular structures are found in the calluses of plantar keratoderma as small black spots that are painful and bleed when repairing the calluses. MBBS can exacerbate plantar pain, leading to significant impairment of patients' quality of life. MBBS have not been studied previously, and there is not much known about the genotype and MBBS phenotype correlations and how MBBS affects the patients. To find out about MBBS, the PC project developed a questionnaire and recruited PC patients enrolled in the International PC Research Registry who have confirmed diagnosis of PC. All participants were educated on MBBS with details on the typical appearances aided by photographs. We used Likert type scales to assess the frequency, how MBBS affects plantar pain, and how much MBBS affects patients' daily life. We used a multiple select question to assess the ways MBBS affect patients. The aims of our study were to determine whether the presence and features of MBBS are associated with specific PC genotypes, and to identify ways in which MBBS affect patients' quality of life. 281 patients out of the 907 enrolled in the research registry completed the questionnaire. This graph shows the PC subtypes of our participants, which is proportional to the distribution in the registry. This graph shows the distribution of patients with and without MBBS according to their current age and PC subtypes. We found that patients with MBBS were generally older than those without. To determine whether any associations exist between the presence and MBBS and PC subtypes, we carried out logistic regression using unadjusted and age-gender adjusted models. K17 patients were less likely to have MBBS. K16 patients were more likely to have MBBS only in the unadjusted model. Looking at the responses on how much MBBS affects patients' daily life, K17 patients had the largest proportion, and MBBS being always a problem, even though they were less likely to have them. This is in line with our current understanding of K17 patients, who are known to have the greatest variation in phenotype, as their plantar pain levels are reported to range from 1 to 9 on a 10-point scale, with plantar keratoderma present in approximately half of the patients. A relatively small proportion selected MBBS makes it impossible to function, which mainly consisted of K6A patients. We conducted chi-square tests and ran association plots and found that PC K6A patients were more likely to have difficulty wearing socks, and K17 patients were more likely to have difficulty wearing shoes. A previous study reported these two subtypes have increased plantar sensitivity, with PC K6A patients most severely affected, suggesting that they may have the most increased sensitivity and severity of neuropathic pain. K17 patients were also reported to have abnormal mechanical detection threshold, which may explain the difficulty wearing shoes, which contributes to the mechanical pressure. We conducted analysis of the mutations within K6A and K16, as there were sufficient numbers to allow comparisons. Mutations were initially grouped according to the affected domain, as seen in the image below, and according to the site of mutation. Any groups with significant differences were then compared with the rest of the mutations within the gene using logistic regression. In K6A, mutations in the 1A domain were less likely to have cosmetic concerns and difficulty wearing shoes. Phenylalanine 174 and 177 mutations were less likely to have difficulty trimming the calluses. In case 6A, mutations in the head domain were more likely to have cosmetic concerns. Arginine 127 were more likely to have extra pain, difficulty trimming the calluses, and require greater time for foot care. Asparagine 125 were less likely to have difficulty trimming, only in the unadjusted model. Our sample size was small, leading to a wide confidence interval, but our findings support the need for further analysis of genotype-phenotype correlations in PC. In summary, NVS were present in the majority of the participants and contributed to a significant impairment to their daily life. We found clear correlations between genotype and NVS phenotype, both with PC subtypes and with specific mutations in each gene, and our findings support neuropathic pain as a significant contributor to plantar pain. We would like to thank Holly Evans from the Pachyonychia Congenita project and PC MSAB and all the participants for making this study possible. Thank you for listening.
Thank you, Xiang Li. That was great.
Thank you.